So you must have gone to the hospital to run a blood group test, and it's either A, B, O, and you must have seen the positive or negative sign attached to it. These signs are what we call rhesus factors. If positive, it means that there are certain proteins in your blood. If negative, it means these proteins aren't there. Now, if a pregnant lady has a negative rhesus factor and her fetus positive rhesus factor, this can lead to rhesus incompatibility. Now, for rhesus incompatibility, the maternal immune system can develop antibodies. Now, these antibodies can launch attack to the fetal blood, okay, causing miscarriages, and stillbirth. This is why it's advisable to go to the hospital during your first trimester, most likely antenatal. Now, certain investigations and tests are usually carried out. If discovered that the maternal rhesus factor is positive, you don't need to worry, you're good to go. But once the maternal rhesus factor is negative and that of her fetus positive, an anti-D injection is usually administered before and immediately after delivery to prevent antibody formation. Now, for certain pregnant ladies, I would prefer to stay back without going to the hospital until when your pregnancy is 9 months. You see why it is important to go to the hospital. And for certain pregnant ladies that have miscarriages, please, it's advisable to go to the hospital and not get anything they give to you and ask you to drink and promise you that you flush everything. Please, it's wrong. Always try as much as possible to visit the hospital. We're always here to ensure that we give you the best treatment. If there's any question, if you do not really understand what I'm trying to explain, you can put your question in the comment section. I'm going to respond to it as well. Always remember that this video is basically for educational purposes, and always remember that good health is wealth.